How many times have your patients come to you asking for an Angelina Jolie jawline or a Kim Kardashian package? Patients are desperate to have the important framing features of a jawline. The jaw is an essential part of beauty. The shadow that it creates that differentiates the head from the neck is all part of what makes for feminine or masculine beauty. That's why patients are always seeking it. But it's really hard. Aesthetic practitioners will struggle with this procedure almost more than any other. And the reason for this is manyfold. It's not simply about injection technique. There are multiple different elements that make a jawline difficult to achieve or impossible in certain patients. As practitioners, the first step is always to understand your patient and what it is that they want. Second, to understand their facial features. And third, to understand your materials and tools to see if what you've got is actually able to create the transformation your patient needs in order to feel happier and more confident. Before you even think about injecting a patient, we need to know what we're aiming for. So what are the aesthetics of a good jawline? Firstly, let's separate between male and female because there's a vast difference. The male jawline is a much larger structure, broader with stronger angles, more projected, and much more dominant in the face as a whole. The female jawline is much more delicate. It is pointier and narrower in all proportions. It also needs to fit in harmoniously with the flow of the rest of the face, as in the angle between the cheeks and the jawline must be a feminine angle. So if you look at the most projected point of the cheek here, compared with the most projected point of the jawline, in a female, that will form an angle of about 15 degrees. That's male, that's female. The next thing to consider is how these shapes fit together. The defining points of the chin are narrow and focused in a female and broader in a male. But it's really the planes that flow from this structure that causes what I call the presentation box of the eyes. Essentially, that heart-shaped face where shadows form a structure that terminates at the chin and splays out to hold the eyes higher up in the face. If you have a look at someone particularly beautiful, for example, Kate Moss is a good example. She has a very delicate, narrow chin at the base, but very wide cheeks that project outwards and hold her eyes. This is ultimately what you're aiming for a feminine jawline. But just because you know what a good-looking jawline is doesn't mean we can now move on to injecting. We need to understand how our injections can either cause more beauty or, unfortunately, the reverse. Starting with male jawlines is actually significantly easier because we're adding volume and angle. And this is very easy to do with a dermal filler, for example. You just add more and you get more masculinity. Of course, that is also exactly the reason why females are often more difficult, because adding more sometimes adds more femininity, but sometimes can add squareness or bulk that makes the female less attractive. So we must select our patients carefully. What are the types of patients that will come seeking jawline treatments, and how do we manage each one of them differently? In day-to-day clinical practice, the biggest problem injectors will have is the patients essentially want definition because they have excess adipose tissue around their jawline. You cannot see the shape of their skeleton because it's covered by a layer of superficial fat. This is extremely hard to deal with a dermal filler. There are some times where you can make a little difference if they're narrow in a section or have a small chin that you can make bigger, that it can make the whole jawline look better too. But ultimately, adding definition or detail to a jawline can only be done in slimmer patients or in patients who have naturally very small proportions that you don't mind making bigger. So if you are going to inject a jawline, where are the common placements? Where should we put the needle in the average female face who needs to be more beautiful or more defined around the chin and jawline area? Although the injection points can look quite similar in different patients, it's really important that we start each procedure with a very clear aesthetic goal. What are you trying to achieve with each injection point? This will help you select the right combination of injection points to get the best result in individual patients. Typically, when enhancing a female jawline, particularly as you get older, it's about restoring the defining points of the chin. The defining points in a female chin typically are a projection of the rest of the jawline. So if you haven't lost the lateral aspect of your jawline, the chin is a projection of the lateral part of the mandible. It comes down and forward in a continuous manner. As you get older, there is a rotation upwards and a loss of the curvature of the bottom of the chin. It becomes a little bit squarer and then sometimes competes with the jowl. So our treatment plan should be to restore the angle of the chin and those defining points so that the low point of the face is very clearly the apex of the chin instead of the jowl or the gonal angle. So this makes it easier to decide where we want to inject. If we are typically slightly lowering the chin and projecting it slightly forwards, then your injection point should reflect this. So you can see even in this model how the curvature of her chin tilts upwards. The apex, the greatest projection on the menton, is higher up than it would be in youth. And what we would ideally like to do is bring it down and anteriorly, which means your injection point effectively follows that strategy. You wouldn't inject where it's already full, you'd inject underneath, go onto the periosteum, and what I like to imagine is that this mandible is now following a trajectory that continues in the plane that your needle is placed. This means as you inject, you should create a greater curvature inferiorly to allow the definition of the whole jawline to finish where it should in the defining point of the chin. Many of your patients will also be seeking an answer to the question, how can I get rid of my jowls? This is common after weight loss in particular. It's important to understand what's actually going on here is not necessarily an increase in the size of the jowl, but rather a repositioning of the fat pad. There is a central cheek fat pad that runs down the lateral aspect of your face, which is usually supported by the ligaments at the mandible and the nasolabial fold ligament, and by a more lateral cheek fat pad that blends that fat pad in so that it forms one structure. As you lose volume or weight as you get older, this fat pad will rotate forwards and down, creating a heaviness. It's essentially a visual competition that breaks out between the jowl and the chin. So what can we do to reduce it? The first thing is this can only really be done with injectables in quite mild cases. You're never going to solve a jowl entirely with dermal filler if it's substantial, relatively large, and well-defined. But there are many tricks you can use to make it look significantly better. So what would I do? The first thing is, this is always easier when the chin is already weak, and making it stronger will both improve the overall ratios of the face, but also allow the chin to dominate against the jowl. It's usually more common that patients with a jowl actually have a smaller chin because they notice it much sooner than the patients who have a stronger chin. So a weak chin and a strong jowl means you can strengthen the chin, which will give you the first and easiest win in the battle against the jowl defining the face. The second opportunity which you may have is to support the jowl more laterally and superiorly. The ideal situation is that the patient has small and atrophied cheeks with almost a bony contour with all that you can see. This you'll see often in 55-year-old women who have maintained their weight well but are slim. They have a very dominant cheek fat pad and almost nothing behind it. So if you replace all of the volume behind with a dermal filler and then build the structure up both laterally and underneath the zygoma, you have a reasonable chance of creating a little bit of support that pulls the jowl ever so slightly backwards. You can then blend in the junctions with the jowl and the rest of the face. So the jowl is defined often by a medial fold. This is the fold caused by the ligaments holding onto the surface of the skin with a fat pad riding over them. So the mandibular retaining ligament and the modiolus resist the fat, causing a crease to form just anterior to those structures. If we've supported them above and then strengthened the weak point that defines those two structures, you will blend in those connecting planes and allow the patient's lower face to become simpler. You can lift the oral commissure. This is clearly visible in many before and afters and make the patients both look happier, but you can also help the patient regain that more youthful heart shape that we always pursue in youth. Let's now consider how toxin can be useful when treating a female face in particular. How do you make a female more beautiful? As a general rule, you make cheeks more dominant and the jawline narrower. And this is what we can do with masseter-reducing injections. Injecting botulinum toxin will atrophy the muscle. It causes it to shrink over about a 6-week period. And in a young female who's relatively square, with weaker cheeks and a stronger gonal angle, you can shrink the muscle and therefore redefine that lower part of the face to make the cheeks more dominant over the gonal angle. Just be careful you don't try and do this on someone who just needs to lose a little bit of that superficial fat. This is a very common mistake with injectors, is that we atrophy a muscle in someone whose face is actually not being defined by the muscle, but instead by the fat on the surface. And what would happen if you did this? Well, you waste the patient's money. They'll be disappointed because they'll still look the same in 6 weeks' time. And you may even cause a side effect without any benefits when treating the masseter. There's a second use of botulinum toxins, which is the platysma muscle. This muscle runs all the way from your upper chest all the way up into your lower face, and it hides the boundary between your jawline and your neck. So if you relax this muscle, sometimes you will get a crisper shadow, as you can see more of the angle of the jaw because it's no longer hidden by the muscle pulling slightly away from the jawline. It can interestingly also create a subtle lift, allowing the cheeks, according to one paper, to subtly lift, and also potentially improving some of the jowl, because the jowl itself is also tugged on by this same muscle. And finally, if there's one treatment that's going to make you want to become a more holistic practitioner, it might be jawline, because the vast majority of patients pursuing this need to improve diet and weight in terms of achieving ultimate beauty. This is impossible to do if you don't currently offer those services without it feeling a little bit uncomfortable when you start to give what my colleague has just called unsolicited advice. Now, of course, all of the advice is solicited if you do a good consultation. So I would frame everything I do as me as a clinician trying to optimize the outcome for my patient. And if the right thing is to lose a little bit of superficial fat with a small amount of weight loss, which often shows very quickly on your face, then that's probably what you should recommend ahead of procedures. Most patients will be grateful, although they may still pursue the quick fix options. And your job is to make sure that you've given them all the available advice. The best advice that they need, even if you don't provide it, is still better than injecting someone who's not going to get a good result. So be candid with your patients, do it with love, and they should receive it well and not hold it against you, even if all they want is the quick fix. So what would I do if a patient clearly not suitable for jawline injections because of being overweight wanted me to put filler into their jaw? There is something that you only learn the hard way in life, which is, in the long run, the truth is your only friend. You cannot avoid it. The only thing you can do is phrase it in a way that doesn't cause offense or harm to them psychologically. And the way to do this is to ask a lot of permission. Is it okay if we talk about other options? Is it okay if we talk about weight loss options as well as injectables? Most patients will be open to hearing other things, and occasionally you might offend someone, but just because someone gets upset because you've mentioned their weight does not mean that you've done them harm. I've also come across many patients who have had awkward consultations that have then become the trigger to change. So just because you get negative emotion in the consultation doesn't mean that you've made a mistake. It's also important to remember that you will still get negative emotion if you try and put filler into a jawline that isn't going to improve, because the real problem is excess fat. So it's important to be brave and kind and mention the truth and give your patients the best advice, no matter how scary it might be, because you simply cannot escape the reality of what the real problem is. If you want to learn more about my new approach to designing treatment plans for patients for the whole face so that they get the best potential result, make sure you click on the link in the description down below and sign up to the waiting list.